Go ahead.
Thank you. Good evening, everyone. My name is Shahinaz Hamdi. I'm the chair of the Committee Health and Human Service. Today, we're going to have the meeting in Zoom, and also we are in live in the YouTube. I'm going to do the roles first. I'm going to call the committee. I have Danielle Alberti. Danielle, Jean Marie. See you. If you want to unmute yourself, I see you. Thanks so much.
Yeah, I'm
Dean,
here.
thanks a lot. Okay, Dean Fertavik. I
I'm
hope so.
here.
Thanks so much, Dean. Chris Hanway. Hey, Chris. Another Rosemary. I believe she's not here today. Rod.
I'm here.
Thank you, Todd. Rod. Judy Travels. Judy. Okay. Rosemary. This is the board. If I didn't call anyone, please let me know. And I see I have another group join us from the board. I have Patricia and Quinelle. Thanks so much, boss. Quinella. Thanks so much, boss, for coming join us today. I see Edie Tomal. Are you from the community board or the public? Edie. Public, thanks so much for introducing yourself. Okay, today we have Adam Abraham is from NYS for going to be a do presentation for the pool trust. And it's really, I found it is something interesting, everyone, if to learn about it, because I found it is not only for elders, is also for youngest, for anyone has a disability. And I believe the best who will be talk about this, Adam. Thanks so much, Adam, for joining us today. And I'm going to mute myself. And if anyone has a question, you can raise your hand or write it in the chat, and Adam will be answer your question. Thank you, Adam, for coming join us today.
All right, thank you for the opportunity, Shahnaz, and I appreciate it. Thank you. Uh, yeah, so good evening, everybody. Thank you for the opportunity to meet with you today and to go over a presentation of how to qualify for Medicaid with the Pooled Income Trust. Again, my name is Adam Abraham. I'm an outreach specialist with NYSARC Trust Services. NYSARC Trust Services is a nonprofit organization. We administer pooled income trusts. We've been around since 1972, and we served over 25,000 beneficiaries in that time. So again, today we're going to talk about how to qualify for Medicaid. We're going to focus on what a pooled income trust is, how that works logistically, and how those two entities connect, qualifying for Medicaid and utilizing a pooled income trust to do so. And we'll take it from there. So before we get into a pooled income trust, I like to connect with the end in mind with his community Medicaid benefits. So community Medicaid in New York provides health services and long-term care for people with disabilities and qualifying adults who meet the eligibility requirements and financial limits. And sometimes people get confused between Medicare and Medicaid. So I stated that Medicaid is a means-tested benefit, meaning that you have to meet certain income and asset requirements in order to be eligible. Well, with Medicare is an entitlement, meaning that you have to earn Medicare through your working lifetime or you and your spouse in order to get the benefits of Medicare. And that doesn't make a difference about your income or assets in order to receive it. Now, some people say, what's the benefit of Medicaid? Why should I even apply for it? How will this help me? So Medicaid can do a lot of things for a person, especially when they need it, such as reduce the cost of your prescriptions. It reduces copays. It's transportation to appointments, dental coverage, adult day services. A lot of people don't know that with adult day services, it's more of a skilled setting as comparison to working in a senior center, for example. And a lot of times it's a lot more expensive. So adult days works very closely in conjunction with Medicaid. So by having Medicaid could really help with a lot of the costs to be eligible for and to pay for the adult day services. Also, home care and assisted living programs. The predominant reason why people apply for a pooled income trust in order to qualify for Medicaid is to pay for home care. Because on average, especially in New York City, it can range on average $30 per hour. So if a person, let's say, needs on average 40 hours a week, that can be roughly $1,200 a week and close to $5,000 a month. Now, of course, if it's more, then it could be more. If it's less, it could be less, but that's roughly just talking averages. So for a person that's, let's say, a little bit above Medicaid levels, all of a sudden those monies can go out pretty quickly. So if people don't know what their options are, they can unnecessarily lose the money that they don't have to lose, that they work so hard for. And knowing that the great thing about a pooled income trust, those are a great option to have and to be aware of. And we're going to talk about that in the next few minutes. So also getting community Medicaid is good for waiver programs such as NHTD, which is a nursing home transition and diversion program, which means it's a skilled level of care like you would get in a nursing home, but you can do it in the community in the comfort of your own home, getting the same type of treatment such as OT, occupational therapy, physical therapy, speech, home care, skilled nursing, all within the comfort of your home. TBI, which is traumatic brain injury, and OPWDD is Office of Professions with Developmental Disabilities. So I just wanted to talk about, when we talk about Medicaid being a means-tested benefit, what exactly does that mean? So these are the 2024 numbers, and I just was at an elder law meeting yesterday to see if there were any updates to the 2025 numbers. And as of right now, nothing much has changed. So the individual applicant, their income is still at $1,752 a month for 2025, and it's still at $2,371 a month for both receiving care for a couple. So just to be clear what those numbers are. It's really $1,732 and $2,351, but then say, why is the extra 20? Because they always ought to add an automatic $20 disregard. So that's why I put those numbers in. And you can't have a pooled income trust. In addition to the income and assets, you also have to have a qualifying disability that's defined by the Social Security Administration. So again, that's not what NYSARC does. That's again a qualifying disability contingent upon the definition of Social Security in order to meet that requirement. And then also in terms of spousal budgeting, it's $3,853.50 a month. And what that means is when one spouse is healthy and one spouse isn't, if the spouse that's healthy gets the money transferred for the spouse that needs it, and as long as their combined income is at $3,853.50 a month or less, they would automatically qualify for Medicaid. So anything above that amount, the $3,853.50, that's where the excess income would be involved. And as far as assets go, it's for an individual, it's $31,175. That hasn't changed. For a couple, both receiving care, it's $42,312. That hasn't changed either. The only number has changed with the spousal budgeting. It ranges between $74,820 up to $154,140. That's gone up about to $157 and change. And what that means is that if a spouse wants to refuse, again, this is where an elder lawyer comes into play. I don't have that information, but speaking to an elder lawyer, they can refuse up to those amounts on a case-by-case basis, depending on your person's circumstances, up to the 154, and for 2025, the 157, where Medicaid couldn't put a lien on that, and your assets would be protected for community spouse refusal. So a common question is, because as we said earlier, Medicaid is a means-tested program that focuses on assets and income. A common question is, what if my assets are too high? So are your assets greater than $31,175? So some people don't understand what assets count and what assets do not count. So primary residence and vehicle do not count, and personal property, they don't count. And just to be clear, when it comes to January 2025, which we're in right now, the market value of the property, in order for the primary residence not to count, the first 1.25 million is exempt. So anything above that would count towards your countable assets. But from 1.25 and under, if the property market value is that, then the primary residence wouldn't count. Also, certain retirement accounts are exempted from payout status. So meaning that if you're taking a distribution, then the asset itself won't count. So let's say an IRA, 401k, 403b. If you already have those retirement accounts and you're taking a payout, you're fine. Meaning that the retirement account itself, the asset does not count, but the income from the asset will count. And right now, with the rules, you have to be at least 73 years old for the required minimum distribution. Also, and you may reduce countable assets and then apply. So again, depending on a person's situation, maybe if they're a little bit above, maybe they can use it for something else. Maybe they can give it to somebody. Maybe they want to use it for themselves. And then as long as you meet the requirement, it's fine. When it comes to community Medicaid, there's no time frame as of right now. There may be in the future, in the near future, but as of right now, there is no look back. So if you wanted to spend down, let's say this month in order to qualify for next month, you'd be fine. There'll be no penalty assessed on that. But again, if you have greater amounts that you say, you know what, I don't know what to do with this. I don't just want to spend it down. I want to preserve it for myself and or my family. What are my options then? So at that point, consulting with an elder law attorney or a tax professional will be the best way to go to get the proper advice and the proper trusts in order to make sure that your assets are protected for you and your family. So then the next part, we focused on the other means component. We focus on asset. Now we're going to focus on income. So now a common question is, what if my income is too high? Because if your income is greater than we stated before, which is $1,752 a month for one individual applicant, what do I do then? How do we utilize this money? So Medicaid uses the term excess income or surplus income when the income is above the limit for as in this example, $1,752 a month. And if you're a couple, $2,371 a month. So NYSARC doesn't determine your spend down amount. Medicaid does. Just like Social Security Administration determines if you have a qualifying disability, NYSARC doesn't determine that, and we don't determine the amount. So these organizations, these agencies determine that. And qualifying adults can spend down the money with a pooled trust. So anything in excess of the $1,752 for an individual or $2,371 for a couple, anything that's above that Medicaid determines that, okay, that's excess income. That's the income you can put into a trust. And it has to be exactly that amount. What Medicaid determines, as Medicaid will give you a notice of determination, explaining specifically what the amount you can transfer to a trust, what your amount actually is. And what that amount is, that's the amount you put in, not $1 more or $1 less. It's exactly that amount. So you can meet them. So in order, and that's important because that's what you need in order to meet the Medicaid requirement in order to be Medicaid eligible. And it's a great option because a lot of times people don't know what to do because let's say we'll use home care as an example. I use the example I gave earlier. If you're doing 40 hours a week on average, $30 an hour, which is roughly $1,200 a week, close to $5,000 a month for an average amount of home care, that is going to go very quickly if you're spending that out of pocket. So people will do it a couple of ways. They'll private pay, and then their money, unfortunately depletes very quickly. The other option is people say, I don't know what else to do, but I know this is the lesser of the evils. Let me give the money directly to Medicaid, and I'll qualify for Medicaid that way. So then Medicaid can pay home care. And in some cases that could be fine. But then the problem is once you give that money to Medicaid, you have no say with that excess money. You can't use it for your everyday living expenses. You'll have to, affect your quality of life and being in your home. And then all of a sudden that power is gone from you. All that hard-earned money that you worked in your lifetime, you'll not have a say in it, which is sad because a lot of people don't do it because they want to, because they feel that's the only choice, because that's what they're aware of. They don't know what else is out there that they can make an informed decision upon. So that's just to be aware of that. Avoid giving up hard-earned income to Medicaid because that is not the only option. And it's also very important that excess income, it must be paid each month from Medicaid's applicant income. So we have automatic payment plans that can take the money directly from the individual account and transfer it to the pool trust account, or you can just write out a check to do so. But it's very important that in order to maintain Medicaid eligibility, you have to in order to keep the trust up and running, you have to transfer that money every month in order to be on Medicaid. So we talked about Medicaid, we talked about the benefits, we talked about the requirements. So now let's talk about how does a pooled income trust connect to qualifying for Medicaid? Even though we talked about it a little bit, but let's talk about actually what a pooled income trust is. So a pooled income trust is an irrevocable supplemental needs trust. And if you see the word irrevocable, it's bolded because a lot of people are not aware. When you get a pooled income trust, once you transfer the money into the trust, you can't say, you know what, I changed my mind, I want the money back. Irrevocable means once you put it in the trust, it stays in the trust. You just can't change your mind and take the money back and then go about spending your money the way it was, because that's what makes you eligible for Medicaid. And if you just have access to whenever you want and spend it for yourself whenever you want, then that wouldn't be a federal policy legal tool to utilize. So it has to be done that way. But it's not like if you put the money in the trust, okay, now I can't use it anymore. That's not true. Or I don't have access to it anymore. That's not true either. You can spend it for qualified expenses. And let's say, for argument's sake, let's say you opened up the first month and then all of a sudden you had to change your heart for whatever reason. Say, I don't want to do this anymore. I want to close the account. You can spend the money down to zero. Once you spend the money down to zero, you call the customer service team up saying, please close the account. You close the account, and then you just take them. You don't transfer the next month's income. But then remember, if that's the case, if you want to stay on Medicaid, then you would either have to pay Medicaid directly or you want to qualify for Medicaid. So those are your options. So NYSARC, as I alluded to earlier, is a nonprofit organization. They manage the funds for the trust beneficiary. So you don't assign it to a loved one or a family member. The nonprofit will be the co-trustee with Key Private Bank. They will manage the funds for the trust beneficiary in a fiduciary capacity. And in order to get the pooled income trust as well, not just being eligible for Medicaid, but as I said before, you must have a qualifying disability under the Social Security Administration definition. So in order to know what that is, it's very important to be aware. Contact your local Social Security office. You can contact them via phone, email. You can go to the office in person. You could look it up on Google. You go to ssa.gov. So there's many different ways to find out what are the qualifying disabilities. And a lot of times it's a lot more flexible than many people think. It could be high blood pressure. It could be diabetes. It could be common things that where you think it may not be a disability, it can count. So that's why that's important. So how do you start that process? You contact Social Security, get that proper information, and then you have to complete a determination disability form that allows you to complete it's a few pages that you work with a provider that documents the qualifying disability that you may have. You submit it to Social Security, and if Social Security deems it that you meet the requirements, they'll send you a notice to let you know, okay, you do meet you do have a qualifying disability under our definition. And that's important because you need to send that document with the trust to verify that you have a qualifying disability under the SSA definition. And also it's important, the pooled income trust, it preserves excess income minus expenses of the pooled trust. And then we'll go over that, exactly what the expenses are associated with the pooled trust. And just to be aware of, when we talk about administration costs, it's not additional costs out of your pocket that you pay. The administration costs associated with the pooled income trust, they're automatically deducted from the spend down deposit. So again, no additional funds coming out, but those funds will be deducted from your spend down deposit amount into the trust. And again, why people get it is because it pays monthly living expenses and supplements care, where if you give it directly to Medicaid, you can't do that. You don't have that as an option because Medicaid takes it, that's it. At least here, you have the option to use it for bills and to supplement your care so you can have a higher quality of life, managing your finances in the comfort of your home. And also it's a lifeline for qualifying adults to get home care, because a lot of times that's the primary reason why people even open a pooled income trust and qualify for Medicaid, so they can get access to home care without paying very hefty private pay prices for it. I think if you do your research, you'll see it can be very expensive paying home care privately. And another thing to be aware of is that Medicaid payback or the funds retained by the nonprofit at death. So that means if there's any funds left in the trust, it does not go to, it obviously does not go to the beneficiary, it does not go to the family or a beneficiary of the trust beneficiary. It stays in there, and then the nonprofit will support their mission for people who have intellectual and developmental disabilities. And again, that's not a rule that NYSARC made. This is a federal policy. So just to know, when you have a pooled income trust, why I state that, the goal is to spend it down close to zero every month. And it's for your everyday living expenses. It's not an asset that you build up over time, because that defeats the whole purpose of having it. The purpose of having it is to pay for your everyday living expenses to maintain your quality of life and supplement your care. That is the primary reason why you have a pooled income trust. Now, when we focus on the benefits of a pooled income trust, it allows Medicaid or SSI applicants, recipients, to qualify and maintain continuous benefit coverage. That's very important to understand. That's why you could do it, because as long as you're transferring the excess income that Medicaid determines your excess income is to the trust, you're going to continue to qualify for Medicaid. Also, you pay for medical expenses that Medicare doesn't cover, because now when you have Medicare, you have Medicaid too, and Medicaid as a secondary can wrap around Medicare and pick up the loose costs that Medicare doesn't pick up. Some of the Part A costs, the deductible, co-insurances, co-pays on the Part B as well. And also Part D, there's coverage gaps and so forth. So Medicaid can wrap around. So it's not just helping you with home care and also giving you access to your expenses that you have access to. It helps you also with health insurance if you need it. And in addition to that, It'll allow you to qualify for the Medicare Savings Program. So for 2024 numbers, it was at least $174.70 a month that was taken out of your Social Security check to pay for your Medicare Part B. And at least with this program, now you can actually apply back and get that $174.70 back into your Social Security check and to get that extra monthly savings every month. Also, a lot of assisted living programs have Medicaid funding. So if you get home care, or if you qualify for assisted living, and they have Medicaid as one of the payment options, that'd be great, because some people know assisted living could be very expensive. You run into thousands of dollars every month. So if you can qualify for Medicaid and Medicaid paid on your behalf, instead of spending thousands of dollars every month, so you could be in an assisted living facility, that can, again, give you extra benefits and extra options that you wouldn't have before. And helps you maintain your standard of living. And in many cases, it helps you avoid going into a nursing home permanently. And another benefit is it's a respite and financial relief to family caregivers, because some Medicaid programs will take care of that, provide that respite relief to family caregivers as well. So how do we join a pooled income trust? So establishing a self-settled pooled trust when you're ready, when you're receiving or ready to receive Medicaid services. So it's important that you make sure you meet the benefit requirements, such as reducing the countable assets below $31,175. Apply for Medicaid. And the reason why that's important, because you can't transfer the excess income into the trust until you know what the actual excess income is to transfer into the trust. And you can only do that by applying for Medicaid and also being deemed for that. Also, as we talked about before, when it comes to Social Security Administration, obtaining a determination of disability. If you already have SSDI, then you don't need that, because you already have a disability under the Social Security Administration definition. But if you don't have SSDI, then you need to obtain that determination of disability and then get that notice from the Social Security office that you meet the requirements, and send that notice to the trust so they know that you met the requirements and you're eligible to join a pooled trust. Then actually establish the pooled trust. You complete what they call a joinder agreement. And in the joinder agreement, it's a document that has a lot of the demographics, authorized contacts. You complete all the information, health information, and then it has to be signed and notarized either by the trust beneficiary, or if there's a power of attorney, have the power of attorney sign, and then have the support of the power of attorney document, or guardianship, or whatever it is, have those proper legal documents with the appropriate signatures and everything being appropriately notarized. So that will, and then also having a copy of your Social Security card or your Social Security information, Social Security award letter to verify your eligibility. Then deposit the excess income that Medicaid determines what it is into the pooled trust. And also Medicaid will give you a notice of spend down amount to know exactly what the amount is that you're eligible for and what you need to transfer in order to maintain Medicaid eligibility. And it's very important when it comes to communication. It's very important. Once you have that information from the pooled trust, you'll get, that's the joint agreement that you complete to enroll into the pooled trust. And then after that, you get an acceptance letter from NYSARC. And usually if all the documents are done appropriately, opening up a pooled trust takes approximately 5 business days. So it's relatively quick. So when you complete the joint agreement and then you get the acceptance letter from NYSARC, it's very important that you send the JA, which is the joint agreement, an acceptance letter to Medicaid to inform them of your participation in the trust. So they're aware that you're taking the excess funds that you'll be eligible for into the trust, so they know that you will be maintaining Medicaid eligibility. And then when you have the pool trust open and you're good to go, then when you want to submit requests to pool trust for eligible expenses, they call disbursement requests, and you support it with the actual documentation that you're actually spending. So for example, it's like your Con Edison bill, if it's rent, if it's cable, as long as you show the bill that's in your name, then in the amount, and you send that in saying, please cover this, the pool trust will pay that amount on your behalf. So we talked about costs. So let's get to that point. What does it actually cost? So in NYSARC Incorporated Community Trust 2 fee schedule, you have to fund it with a minimum of $300. And the reason why is that there's a one-time enrollment fee of $200, but you have to keep also a minimum available balance of $100. So that's why when you start, it has to be a minimum of $300. Then you have monthly fees deducted from the deposits. Excuse me. So the monthly cost is based on the deposit amount. So it can range as low as $30 a month that they will have a monthly cost, up to $420 a month max. And again, that depends on your excess. If you're, let's say, a few $100s above, it'll be close to the $30 a month amount. If you're, let's say, at a few $1,000s a month, then it'll be closer to the 420. And if you want to know exactly what the amount would be, sorry, excuse me, you go to our website, nicearktrustservices.org, and then we have a cost calculator. So once Medicaid determines what your spend down amount is, then you can say, okay, now I know exactly what I need to put into the trust. You put that amount in, and to the penny, it will tell you exactly what your cost will be. So there's no guessing. You'll know exactly what your net amount is every month that you have access to. And also, they have bank fees that are less than 1% annually, and it could be $1 to $2 depending on the balance in the trust. And then once a year in July, they have an annual cost of tax prep and an independent audit that audits our records to make sure everything is done properly. So they charge the member $75 in July. And the good news is there's no limit on monthly disbursement requests, and there's no annual renewal fees. All right, so how pooled income trust works and some of the rules: you can either make deposits electronically or by check. More people now are doing electronically just for ease and not to make mistakes and forget. So it's just a more seamless process to do so. But of course, if you're not comfortable with that, you still could do it by check if you like. One thing I really want to stress, if you see in bold, is the primary benefit rule. And what that means is that the primary benefit rule focuses on the beneficiary. So the purpose of this trust is serving the benefit of the beneficiary in this trust. It's not serving anybody else. So, for example, if Mrs. Jones is the trust beneficiary, it's not for Mrs. Jones's spouse. It's not for Mrs. Jones's children. It's not for Mrs. Jones's best friend, cousin, whatever. It only services them. So, meaning any expenses, any disbursement requests can only be in their name, only for themselves, for their benefit. That's why it's called the primary benefit rule. And when we talk about eligible expenses and ineligible expenses, you'll see how that works more in depth. Also, items and services to supplement benefits. So again, there's a lot of things that you could utilize for a pooled income trust. That's a lot of flexibility that you could supplement the benefits that you already have. But again, it's very important that we don't take your word for it. All the requests require supporting documentation. So you have to show that bill, show all that information from the third party place, documenting the place, documenting the amount, and then we pay on your behalf to that place out of your trust account. Now, bills that are the same amount each month, you pay them automatically. It's very important to try to be streamlined and seamless as possible, so it gets just ease of practice for you. And requests are payable to third parties only. It's very important. It's not like to your best friend, to this, that. It has to be a third party tax ID and making sure that they're licensed in what they do. No cash or payments to beneficiary, as we explained before, because it doesn't belong to you. It's irrevocable. And no payments after death per federal policy. So again, because of the federal policy, to make it a qualifying, a pooled trust, that's why we can't give it back to the beneficiary, because it only serves you in living. It's not designed for loved ones after the fact that you're beneficiaries. It's just for you in your life in real time. All right, so let's talk about, expenses. So again, this is not a fully exhaustive list, but it's examples of allowable expenses and examples of ineligible expenses. You'll see the patterns as I go over them. So bills and basic living expenses: rent, mortgage, maintenance, utility bills, vehicle, transportation, insurance with the exception of life insurance, and I'll tell you why when we get into the ineligible portion. Personal items, services, an irrevocable pre-need burial contract, which means that, let's say, while you're alive, you're getting a contract for pre-need burial. As long as it's an irrevocable contract, the payments from that support you at that time will count as an allowable expense. Technology and equipment, like say laptops, desktops, iPads, cell phones, that all counts. Recreation, travel, leisure. If you want to take a trip somewhere, you want to go someplace, that's not a problem. That will also be an allowable expense. So examples of ineligible expenses: cash to the beneficiary, because as we said, it's irrevocable, so you just can't take cash out. Reimbursement to the beneficiary under the same principles. It's not your money. You have to use it for third-party expenses. Reimbursement or rent to spouse, as we explained. Sorry. Property expenses not owned by the beneficiary, because it has to be for the primary benefit of the beneficiary, so it has to be owned by them. It has to be strictly in their name. Gifts for others, because it's not for you, that's why it wouldn't count. Now, life insurance policy, why that is an ineligible expense, because a life insurance policy, even though you're the insured, but it's the beneficiary of the policy that's receiving the money. It's not the primary benefit of in the trust. So because of that, it's not serving for the primary benefit of the beneficiary. It's an ineligible expense. Services already provided by Medicaid, and alcohol, tobacco, firearms, bail, or restitution, those are ineligible expenses. But ultimately, it can always be a case-by-case basis. Nothing is finite in terms of it's this or that. Trustees ultimately have the discretion to approve or deny requests. Sometimes there could be extenuating circumstances. So you don't want to, again, we give just examples, but sometimes extenuating circumstances take over. And if a trustee feels that that could be accepted, where in the past it wouldn't, then that could be an exception to the rule. That can happen, generally doesn't, but I don't want to say it's 100% no. So just want to let you be aware of that. So what now we'll do is we'll give some examples. So you see here, Roberta, she's 78 years old. She receives Medicaid with a spend down. She lives with her daughter, Jane. So she was eligible for $1,700 a month Medicaid determined to deposit into her pool trust. But the pool trust cost approximately, for this type of spend down amount, $122 a month. So that doesn't mean that she takes an additional $122 out of her pocket every month to give to the pool trust. It's just deducted. So now she has a net of $1,578 per month to utilize from the trust to pay her bills, such as $1,500 a month rent to her daughter, portion of utility bills, internet cable bills, portion of food expenses, and her $70 a month cell phone bill. So that's an example of how that would work in that case. Now, another example, Henry, he's 81 years old. He receives Medicaid with income spend down. He lives at home with his wife. His spend down amount was determined by Medicaid to be $3,000 a month. And he takes that $3,000 a month and he deposits it into the pool trust. But his trust, because of his trust amount, is approximately, his costs are $182 a month. So that means he has approximately $2,818 a month to utilize. So he can use that money to pay bills such as his monthly mortgage, which is $2,200 a month. He has a $250 a month gas, electric balance billing. He has $150 a month cable internet, homeowners insurance, landscaping, property maintenance, and taxes. So you see, you can use a lot with this. There's a lot of flexibility. And our last example is Robert. He's 35 years old. He receives Medicaid and SSDI. So because he has that automatically, he wouldn't need a determination of disability because he already meets the requirements through SSDI. He lives in a residential facility. His spend down is $450 per month. So his pool trust costs will be approximately $40 a month. So that means he has $410 a month to utilize from the trust. So he can make available for him for purchases such as a $90 a month cell phone bill, $20 a month streaming services, iPad or other electronics, art supplies and classes, music therapy, video games, and admission to summer camp if he so chooses. So you see, again, a lot of flexibility. So when it comes to best practices for ease of management, it's important that you want to automate the bills that are the same amount, because at least you don't have to worry about that. You know, it's going to be the rent is $1,500 a month. If this bill is the same amount each month, take all the bills that you can that's up to the trust allowed amount and automate them. So you don't have to worry about it and try to keep track of everything in that sense. Oh, I got to pay a check out here. It just makes it a lot easier for you. Also, what you want to do is you want to align the bills that amount to your spend down. You don't just want to pick any bills. You want to say, let me pick a few bills that amount to your spend down amount, and then the other $1,752 that you can, you utilize that and do what you want with it, whatever feels appropriate. But when it comes to the trust, to make sure everything is aligned, again, pick a few bills that amount to your spend down. Also important, use a credit card. Do not use cash or a debit card, because at least if you have a credit card, you have the actual expense from the credit card, they'll pay the credit card back. Because using cash or debit card, it's implying that you have it, it's for you, and again, it's supposed to be for a third party, not going back to you. Automated bills on a credit card and send one request. That is the best way to do it, because at least you know that credit card has all the eligible expenses that they pay on your behalf. You have that amount. They'll pay your credit card for those eligible expenses, and you're fine. Large vendors are paid electronically, such as the Con Eds, the Verizons, all those places. We have all their information. We can pay it electronically once you provide authorization. And the best way to try to get those bills paid as quickly as possible, don't usually wait for the paper statements, because that generally takes a lot longer. Try to download the bills online and then just take the PDF version or whatever, and then submit that to the trust directly. Every trust beneficiary will have access to a portal They'll get a username and password, and they can put their disbursement requests online directly. They can copy the attachments of the bills online directly. They can see their statements, everything in real time, what's coming in, what's coming out. They have access to it 24 hours a day, 7 days a week, 365 days a year. So, and also any authorized contacts that you allow on the that you state in the joint agreement will have access to that as well. So some questions that people have are, can I opt out or switch out of my pool trust? Let's say, you know what, I changed my mind, and as I said earlier, I no longer need it, I want it. Yes, you can stop the deposits anytime and send the money to Medicaid instead, but it's very important that you spend that down to zero first, close the account, and then do it that way. But again, if you want to stay on Medicaid while doing that, then your options are you send the money directly to Medicaid, or you say, no, I changed my mind, I don't want to be Medicaid anymore. That's fine. You just forego the Medicaid services and then private pay instead. Can you switch your pool trust? Yes. All you have to do is you can stop the deposits with the previous trust and open the account with the new trust. But it's very important. Do not miss a spend out payment to avoid losing benefits, because you have to be consistent every month. Because when you recertify Medicaid, Medicaid is going to ask you for a verification of deposit. They want to see that every month you were transferring the excess income in order to be eligible for Medicaid to the trust, so you're maintaining Medicaid eligibility. So it's very important to be on top of that every month. So there are some exceptions when it comes to being in a nursing home. So a common question is, what happens if the beneficiary goes into a nursing home? Now, there's two types of placements. You have temporary or short-term rehab, or you have long-term placement. If you're in temporary short-term rehab, during the rehab period, a person is still required to pay the spend down and typically continue the deposits into a pool trust if there's an intent to return home. But let's say, you know what, that's not going to be the case. Let's say I'm going to be in the nursing home long-term. So if that's the case, you stop the deposits into the pool trust. Most income, including surplus, now has to go to Medicaid to cover the cost of the nursing home. So that's why that's very important to understand which one you are. Now, the pool trust balance, you can submit requests to utilize the balance up to the date of death. And transfers after age 65, when it comes to a nursing home, unlike community Medicaid, is subject to a 5-year look-back period. Again, so let me be very clear. Community Medicaid, as of right now, there is no look-back period. But if you go into a nursing home after age 65, you are subject to a 5-year look-back. Unspent balance may be an available resource. And for anybody that does go to a nursing home prior to the age of 65, there are no penalties for transfers. So my advice to you is, if you want to learn more about it after tonight's presentation, go to our website, www.nisarctrustservices.org. It's a great user-friendly program, has all the information about policies, procedures, costs, frequently asked questions, all our documents, has a lot of great information that's going to make you very well informed. So if you decide you want to learn more about it or do it, they give you all the proper tools to utilize. And thank you so much for your patience and listening all this time. You know, if you want to give us additional information, you see the number here is 518-439-8323, or you can email our intake department at intake@nisarc.org. Go to our website at www.nisarctrustservices.org. And our customer service lines are open from Monday through Friday from 9 to 5. And I'll open up for any questions.
Thanks a lot, Adam. And it was really informative as usual. We're going to open now for the question. If anyone has a question, you can raise your hand and Adam will going to answer. Or if you don't want to do it in the chat, you can put it in the chat. Okay, we have a Quinella. Quinella, unmute yourself, please.
Sure. Hi, everyone. Happy New Year.
Happy New Year.
Okay, I'm just assuming that the groceries is not part of the monthly expenses because these people are eligible for food stamps, I guess.
Yeah, so basically, if let's say you use it for food items, yes, it does qualify for that, as long as it's for you, with the exception of alcohol and tobacco products and things of that nature. So as long as you have a receipt, but the best way to go about it is use a credit card to pay for that, and then they'll pay the credit card for that amount, subtract whatever ineligible expenses are on the receipt. But it has to be primarily for the beneficiary of the trust.
Okay, thank you.
Anyone else? Okay, I have some question for you, Adam.
No problem.
Let me be ready here. For you, as usually do this a lot, if like what makes some people doesn't want to do the bull trust? What they make them scared from the bull trust?
Absolutely, great question. So a lot of times they feel like that I'm going to lose my money, that my benefits will be affected, that something will happen to my account and I don't want to have any issues, or there'll be certain expenses that they want to spend and then they won't count. And to tell you the great thing about the program is incredibly flexible. So literally, if you want to be in the pool trust effective February 1st, and you're in the trust, and let's say a couple weeks later, say, you know what, I changed my mind. All you have to do is just spend that balance to zero, and then you just start making deposits, and you don't mind closing the account. It's not like you're locked in to a contract where you have to have it for an X amount of time. It's a very fluid trust.
Okay, my other question, you said in the start about Medicaid, you can put your money in Medicaid, or you can do the spend down in the bull trust. I hear some people say like if you do it, I don't know if this is correct or wrong, but if you do it in Medicaid, people get scared also to do this because Medicaid they take their property like the house or something if they own it after they die. Is this true?
Right. So, I mean, and this is where more of like an elder lawyer is better equipped to answer this question, but it can be where Medicaid has the right, if you don't have a trust, that let's say you put that money to Medicaid and now Medicaid supporting services, they could put a lien on property and so forth to try to attempt to recover. Sometimes they do, sometimes they don't, depending on the circumstances of the person, but they have the legal right to do that. But that's why speaking with an elder lawyer to try to protect your assets, putting them in a Medicaid asset protection trust, and of course they can go into the details. They can tell you legally how to protect yourself from that. But yes, a lot of people are concerned that they can do that. And part of the community spouse refusal is that you want to try to use that range I told you before between the 74 and the 154, which is now up to 157, where a community spouse can say, you know what, I want to keep this amount and I don't want to give this to Medicaid in the event they do want to put a lien and try to get that money back. That should be protected. Again, that also they can technically go after that, but it'll be very difficult. But Medicaid will try to go after whatever they can if they do that. Now with the pool trust, because it's for the federal policy, this particular trust, they cannot put a lien on that because whatever the balance is, if there is a balance upon the person's death, it supports people per federal policy for people with individual and developmental disabilities, and Medicaid knows that, so they can't put a lien on this account.
Thanks so much. My other question regarding when you was explaining about when people pass away and they have still money left in the pool trust, you said where is this money go where?
So it supports people with intellectual and developmental disability. So when it comes to NYSARC, they have ARC chapters all over New York State. And they have recreation programs, housing for people with intellectual and developmental disabilities. So if there are any funds left in this particular trust, it would pay for programs for that to support that. But the goal is, as we tell people, and again, this is not a NYSARC rule, this is a federal policy. It's required for them to do that because it can't go back to the beneficiary because that's what makes it irrevocable in this regard for the person who's the primary trust who's living. It's not an asset to protect. It's not money to give. The purpose of the pooled income trust is to support the primary beneficiary in this regard for their everyday living expenses till they're not around anymore.
You. My last question is when you have the pool trust now and you said we do the deposit, does the person has to have open a new account in the bank, like to be separate from the regular bank account? This way they do put the deposit there, or you get access to their bank account, the regular one?
Right. So it's an authorization. So whatever bank account you decide, so they're going to send you like those forms, an electronic deposit form. So you'll put the checking account or savings account and the routing number. They'll complete all the information, the date of that you want it taken out, as long as it's done within the month. And then to transfer that excess income, it can only be what Medicaid determined the excess income. It's not that what the person decides. Medicaid determines it. They send you a notice of spend down amount. So whatever that amount that Medicaid determines, it's exactly that amount that needs to be transferred into the trust. That will allow you to qualify for Medicaid and then maintain Medicaid eligibility.
Yeah, like the trust take it every month from the personal
Correct.
account.
Right. So by having to do an electronic deposit, it'll be done every month. But let's say a person's not comfortable with that, then they would have to write out a check to the trust within the month. So it shows, because Medicaid will ask for, when you recertification, they're going to ask for verification of deposits, and they want to know that every month you were depositing the amount of Medicaid that was excess into the trust to qualify and maintain Medicaid eligibility.
Thanks a lot, Adam. Anyone else, please, if you have a question, unmute yourself or raise your hand.
I have a question.
Jean-Marie. Yes, Jean-Marie, go please.
Okay, there's something that I find hard to understand. I know someone who has like $250,000 in an IRA, has this pool trust thing, and has Medicaid, has 24/7 home care. And how do they allow that you can have that much money and still be entitled to Medicaid and have that like 250,000 that they're going to leave to their beneficiaries?
Right. So that's not the pooled income trust that we were talking about. That's a different type of trust. That it could be either a Medicaid asset protection trust, or it could be a pooled trust that focuses just on the assets. So you could protect that from Medicaid and then use those assets for qualifying expenses, similar to the pooled income trust. And that allows you to maintain Medicaid eligibility. So when Medicaid will pay for home care. So that's a different type of trust you're referencing.
Yeah, because she gets everything though.
Right.
She gets free
Right.
medication. And I think they give her like $2,000 a month to spend.
Right, because she can have qualifying expenses that can meet that requirement.
Living expenses. Right.
That's based on the rules of the trust and what Medicaid will
And
allow.
they allow you to have that much money?
It can even be more than that. Yeah. So if you, like I'm saying, working with an elder lawyer, that's what a big part of Medicaid asset protection trusts are about. So that's another way to do it, because that's what a lot of people do. They'll put the income on the pooled income side, and then they'll put the assets on the Medicaid asset protection trust side. So it protects their assets and income so they can qualify and maintain Medicaid eligibility.
Okay.
Thank you, Jean-Marie. Thank you, Adam. We have Florence. Yes, go please.
Good evening, Adam. I'm going to give you a scenario. There is an adult who lives at home with developmental disabilities. The adult never worked, but lives with their parent. Their parent is middle low income. Would the parent be able to put the developmentally disabled child into a pool trust so that if the parent should pass away, because the child is an adult, a full adult, so that the assets are protected because the child is not able to fiscally care for themselves because their emotional age range is young? Would this be a vehicle that parent could use for the developmentally disabled child? And can you expand on ARC a little bit?
Right. So as far as the pooled income trust is concerned, this is a CT2, which is a community trust too. It is not designed for people developmentally disabled. However, we do have a third-party community trust that supports exactly what you're talking about. It protects the assets to transfer. So in the event that something happens to the child, it will not affect their benefit eligibility. The parent or the loved one who's responsible, the guardian, can transfer those funds to the developmentally disabled child, and it can protect and make sure they stay on SSI, to stay on Medicaid, and any other benefit programs that they will not lose on if they transfer, if a parent or a loved one transfers the funds to that particular child.
I'm sorry, you went a little quick, and I'm not sure I understand it. And I'm not sure that I articulated my question well. The parent is completely healthy.
Right.
It's a child who has a disability. And it's for the child to have the Medicaid and the services and the money taken care of for the child. Did I articulate that well?
Yeah, so that's it. So that's a third-party community trust. So it's a third party for a loved one with a disability.
Okay. So if I were to share this information with an individual, would it be the same phone numbers and everything that you gave in the presentation?
Yes, it's on the same organization. Yes.
Can I ask for you to email the hard PDF to our office, please?
Yes, I can send that to you.
Thank you, sir.
You're welcome.
Thank you, Florence. Thank you, Adam. Anyone else, please? Please feel free to ask a question. Okay. Thanks so much, Adam, for coming today and joining us today and informative presentation. Last call. Anyone question before we let Adam go? Okay. Thanks a lot, Adam.
Thank you so much.
See you.
I really appreciate meeting everybody. All the best to you. Have a great and
Thank you. Thank you.
You too. Thanks
Thank
so much.
Bye-bye.
Okay, everyone. This was our agenda today. If you have any new business, please, or any item you want to talk about it, or any another presentation to bring it to our meeting. Any idea? Any comment? Okay, that's mean we're doing good. Thanks a lot, Jean Marie. I will say it by how I see people in the screen. Jean Marie, Chris Hanway, Quinella, Rod, Patricia, Dean, and AD from the public, and Christina. I hope so I said correct name, everyone. Thank you, everyone. And let me see if anyone has something in the message. Thank you, everyone. Thank you for your comment. And I hope so you enjoy the rest of the night. And happy New Year again. And see you next week. Thanks a lot. Thank you, Florence. And thank you for the studio. Thank you. Have a good night.
Thank you.
Thank
Have a
you.
nice night.
Thank
You
you.
too. Thanks so much. Have
It
a good
was
night.
very good. Thank you.
Thank you, Jean Marie. Thank you for coming today.